What are the implications of this on the vaccine strategy as it's being practiced today?
Okay, well, when we began this talk, I emphasized that a major difference between mucosal and systemic immunity is the generation of suppression mechanisms aimed to suppress the inflammation that would otherwise blow up the body. Now, this is a story that goes back to a chap called Sulzberger and Chase back in pre-1950. It goes back to the whole area of oral tolerance for the pediatricians wondering why people don't get sensitivity to foods, knowing that 2% of all the proteins we eat get into the bloodstream. And the body has developed this system where you downregulate response. And this is exactly what's been happening with COVID. All of us have been getting coronavirus infections over many years. Every time we get these infections, a little bit goes down into the gut, and you're stimulating not just an antibody, and we know that most people who get COVID have still got residual antibodies against the normal seasonal coronavirus, and they probably have a little bit of protection. But we also know that you're stimulating suppressor mechanisms. So it's all about a balance between the positive and the negative. And so all of us have in our lymph nodes, in our systemic immune system, existing immune responses that protect and immune responses that don't. And some of the early work that my group was involved in was showing that these are two sequential waves. Now, what we're seeing, and I think the best data is probably the British data, the Danes have shown something similar, you'd be very familiar with a lot of this, is that after about 6 months, and this is what a lot of people couldn't understand, the vaccines aren't working very well. And they're saying, oh, maybe it's Omicron or something like this. But in fact, the reality is you're starting to get this downregulation. And people are saying, well, wait a second, this is not like a measles vaccine. It's like a flu vaccine. And the flu is a very good analogy. What you see with flu, you're seeing with COVID. And the current situation of giving lots of fairly sort of panic reaction boosters is that we're starting to get a situation where we're getting a bit like food. We're getting a non-responsive systemic immune response. And this, of course, is the reason why we're starting to see in some countries more infections than we might expect. We're hopefully still getting the blunting of the serious because we're shifting away from serious to less serious infections. But the downregulation, and I think the concern is, I was just reading something about the fourth vaccine in Israel. You might have seen, John, that it looks as though they're getting antibody, but they have to be very careful. You can't relate antibody to protection. It's a surrogate parameter, something that helps you get an idea of sensitization, not necessarily protection. And so you have this situation whereby people are saying, wait a second, this is crazy. We're giving more and more vaccine, but we're getting less and less benefit. I think just looking at your own UK data from the first boosters, my reading is you're probably getting protection only for weeks, maybe a month or two.
Yeah, that's right.
And then you're back. And people say, wait a second, we got 6 months the first time. Now we're getting just a couple of months. What's going to happen when we have the next one and the next one? And so my driving compulsion is that we need to look at Plan B. I'm an immunologist. I'm certainly a very keen vaccinator.
Oh, of course.
We need to do it scientifically, and we may need to bring in strategies with using widespread early treatments that are cheap and available, which I suspect I'm not allowed to talk about on this program. But we all know about them and we know how effective they are. And to me, that is where, but we're not getting this information transferred to the decision makers in the way in which I would like to see happen. I have never heard once anyone talk about why it is we're getting a turnoff of immune responses. And there's this whole precedent that it's not secret. It's all about the mucosal tolerance, this downregulation that you stimulate a positive, you stimulate a negative, and the balance determines what you see. Does that make sense to you?
It does. And this is exactly the data I was actually looking at yesterday, that with the first 2 doses of vaccine, you got a fairly good protection against symptomatic illness for about 20 weeks.
Yeah, exactly.
After the booster, it's down to 10 weeks.
That's right.
So presumably, if we extrapolate the graph the fourth dose in Israel, we're probably looking at protection for only 5 weeks.
I think that's what they're